Well, I'm back up here in Canada. I can't believe it's been like 4 years, and we're excited to be here and visit family, visit friends. Been a great time to connect. One of the most common things as a physician I'm asked is, what's the biggest difference between the American healthcare system and the Canadian healthcare system? Well, one of the biggest differences is upfront cost of healthcare to the consumer, the patient. So for example, in the United States, did you know that the number one cause of bankruptcy is medical bills? Isn't that crazy? Even people that have healthcare insurance aren't immune. So last year, there were about 200 to 250,000 people in the United States that filed for bankruptcy, even though they had healthcare insurance. So you're not immune from it, even with healthcare insurance. Versus in Canada, it's going to be different. In Canada, with the universal healthcare system, you pay higher taxes, and that pays for healthcare. So you could be so sick, you could be sick with COVID, a major traumatic event requiring hospitalization, extensive surgery, and then you come out not paying a dime. So that's one of the biggest differences. And I think that's why so many Canadians are afraid of the American healthcare system, is they just hear bankruptcy. They hear of the exorbitant fees, versus here, they're not afraid if they have to get surgery, they have to go to the emergency room, or there's some traumatic experience that can occur. So there's definitely pros and cons of each system, neither of which are perfect, but probably that upfront cost and the cost to the consumer directly is what I see as one of the biggest differences between the American and Canadian healthcare systems.